I think they put the lockdown to Mubende, Kasanda, and other districts that are around. But now she says that if cases continue increasing, then they may be having no option but close the movements and other things. And we've been having some threats that may even have the lockdown in Kampala. There's so many things that have been talked. Let me start with the government. Damba Emmanuel, Senior Environmental Health Officer and Infection Prevention and Control Focal Person Wakiso and Health in the Health Office. How far is the fight? Where have we reached? What do you have to tell the people of Uganda? But before that, I would love to know what your offices do, all of you, what you do, and what are those efforts that you've done in your respective institutions to fight the Ebola virus disease. Let me start with you, Damba.
Thank you very much, Mr. Moderator. I greet everybody in Uganda, especially the people I work with in Wakiso, my DHO, my cow, RDC, all those people I work with in the office, and maybe the family as well. Yeah, as a person who is working in this department, we are doing all what it takes to ensure that we keep the people of Wakiso, we keep the people of Uganda safe. Now, as a district health officer, our major role is to ensure that we coordinate the implementation of all measures that have been brought down from the ministry, from the policy level, that is the ministry, up to the district, so that we coordinate all activities that are involved to ensure that people are kept safe. Amongst a few of these, we are responsible for having our own plan, budget, and implement and ensure that it is implemented. Now, amongst the other activities which I would like to inform the whole country is that people must know. So in that regard, we ensure that we do mass mobilization, teaching people how this disease is first of all caused, transmitted, and what they need to know to ensure that they prevent this disease. You know, if you don't know, even it is even written in the Bible, if you don't know, you always go astray. So our role is to ensure that people know. We keep the people in the side of knowing, so that whatever will come by, they are able to also participate in the fight. Yes, quite a lot we also do. In this response, for example, I think we may first continue with this Ebola virus. We've had a number of meetings, coordination meetings, of course, whereby we involve every stakeholder at all levels. Stakeholders, these are people who are supposed to take part in ensuring that this disease does not spread like it is supposed to spread. Then the other thing we have also done is to train our health workers. You know, the health workers are the frontliners who, by all means, anybody who gets sick will begin by either visiting a clinic, coming to our healthcare facilities, government, non-government, And those people, if they are also not aware of, if the health workers are not aware of how the best way to handle the situation of maybe this Ebola, like how it is today, then they will run away, and then the fire will continue burning. So we have ensured that we also equip them to at least confront this problem of Ebola virus disease. We've gone to through media and all other kind of channels possible to ensure that we bring anything around the virus be known. Right now, we've also constituted teams, what we call the rapid response teams, that are responsible for responding or getting into the area of curbing this situation. If there is any alert that has been brought forward, it is this team that is responsible for ensuring that all the necessary actions around that case, for example, are taken. We are also doing the test, the collection of samples for those ones that have been suspected, and ensuring that they are delivered to UVRI, that is Entebbe, the National Virus Institute, Entebbe, for purposes of diagnosing, ensuring that what is the disease? Is it the real Ebola or any other disease? You know, we have other hemorrhagic diseases that are almost like similar to Ebola. We can also be able to get to know all that. Yeah, we are going forward also to engage other stakeholders, particularly those implementing partners and government, to ensure that there is protection of our health workers. We've proposed to them to see to it that our health workers, being the frontliners, are protected with supplies and logistics. We've done that. We are going also forward for those suspected cases to ensure that we do a follow-up. Amongst the activities under follow-up include contact tracing and listing. Some of those ones who we see that they have been in contact with a case that has been confirmed, we do what we call sometimes either we evacuate them depending on the situation. We call the people who are responsible for evacuating into the centers where they're supposed to be, to take them. If we also continue to ensure that we educate the communities around the cases that have been identified, we need to educate them in a friendly way that makes them not to become like stigmatized or to become like, oh, what a hell around us, you know. So we ensure that we let them know how to continue preventing and also watching over their health. We even give them numbers, the toll-free numbers, where they have to call if they see anybody with the signs and symptoms, as it has always been running on the radios and all that media. So those are some of the activities where we are.
Okay.
Yes.
Interesting. Thank you, Damb, and we're glad that you're part of this edition to educate and inform the people of Uganda about this serious disease. A lady in the studio, Jane, most welcome to the show, and I'm glad that women have been represented. Your wives, your mothers, and to me, this makes you the most vulnerable in this country in as far as Ebola virus is concerned. We are most welcome. And what is that known as? What do you do in your institution, and how far have you gone with the fight against Ebola virus disease?
Thank you, Mr. Moderator.
Welcome.
Yeah, Jane Francis is my name, and I'm representing all the Ugandan women, as you've rightfully said. I work for Women in Development Uganda. It is a community-based organization that looks after the welfare, health, and every other thing surrounding a healthy family within communities. Now, Women in Development also supports a lot of women throughout the country on safe motherhood, and then we fight issues of gender-based violence. But we also realize that health is a right of every woman, a right of every community member. And so during this outbreak of the pandemic, Ebola, we are doing mass sensitization, especially among the female population, because we know almost all the homes are managed, and every activities in the home are almost carried out by women, and they're better placed to sensitize their families, to sensitize also other community members. And we're also trying to make sure that any suspected cases within the communities are reported through the different WhatsApp groups that we've created that are apparently acting as the task force, informing us of any suspected cases, and also informing us of the steps taken by our community health officers. Women in Development is trying so hard to see that every community has information, the basic health information concerning the preventive measures. So we give this information, making sure that communities know what to do to avoid any further infections. Thank you very much.
Most welcome, and we are glad that you are part of the fight against Ebola virus disease as women. Most welcome to the show, Adeniman Parfait. Is it Parfait or Perfect?
My name is Parfait.
Parfait. Interesting. You are the medical practitioner, and what do you do in Nakasero Hospital? How far have you gone with the fight against Ebola virus?
Thank you so much, moderator. Well, I would love to answer all or any questions. However, allow me to answer anything in the capacity of me as an individual, not as a work of Nakasero Hospital, because I'm not authorized to speak on behalf of Nakasero Hospital. Yeah, so I've met many different people in the communities with no clear answers of what Ebola is, and not knowing how it's transmitted. So when I got this invitation to come and talk as a health worker, it was a privilege to serve the communities, and some will give a few highlights. And I'm also impressed that the government is alert and is doing all that it takes to make sure that it contains this outbreak. I'll start by giving a few highlights about Ebola, and explaining, because I've had a lot of propaganda and many people not having clear explanations, but spreading different hypotheses which are not valid. I would like to let the public know the the people of Uganda that this virus has been in Africa ever since 1976, when it was first detected. It was first identified in 1976, and after 2 simultaneous outbreaks. One was in Zara, in the town of South Sudan, and the other was in Yambuku, in what was called Zaire, now called the Republic Democratic of Congo. It was actually in a village near the Ebola River where this disease gets its name from. So the Ebola outbreaks occurred in those 2 villages, one in Congo, another one in South Sudan. And since those outbreaks, we have been having others in different years in sub-Saharan countries. So for this time around, it has come to Uganda, and it takes everyone's contribution and everyone's inputs are required to see that we deal with this and finish the battle well. So, Mr. Moderator, any further questions that you'd be having for me, I'll be glad to answer them as me.
Interesting. Thank you so much for being part of UBC Ground Zero today. Charles, I'm glad that you're joining us for the second time, and thank you for always creating time to speak to the people of Uganda. How far have you gone with the fight against Ebola virus disease?
Like you introduced me, my name is Charles Ofono. I'm Sabia Waka Waka. I'm the executive chairperson of Foundation for Rural Housing. If majorly what we do in the communities where we work is interventions on matters of hygiene and sanitation. First of all, if I don't appreciate what the government of Uganda has done in the fight of this outbreak, it would have been a disservice. But allow me put some light in 3 perspectives. May appear to be historical, analytical, and strategic in my approach to this question. Like it has been observed, Uganda is not a stranger to disease outbreaks. Ebola has been here. This is not the first time, like Doctor has said. I ably remember in 2000 when we lost Dr. Lequia Matthew. That was the first time Uganda, I think, was at the lowest in terms of fear. And the country was very, very scared. It was not even comparable to COVID-19, I remember. But this is what we need to understand, according to the few research I've done, about the nature of Great Lakes region. And when I talk about Great Lakes region, I'm looking at countries within the Lake Basin. Uganda, DRC, Rwanda, Burundi, South Sudan, all these countries. There has been a habit of, as a matter of livelihood, surviving on wildlife meat and many other aspects related to the wildlife. Many of these animals are not vaccinated against any disease. So somebody goes into the wild, kills an animal, goes to feast on. Some of them reach even as far as Kampala here. Little did I know that this process is also a challenge to tourism. So wildlife survival is greatly contributing to disease outbreaks in this region. So as planners, I would think there will be a very great need to have an intervention to limit or eliminate survival on wildlife meat. We should also be aware that the Great Lakes region is also a hub of conflicts. And these conflicts usually bring refugee influx into the country. And when somebody runs away from a conflict, there is no room to have a scrutiny, diagnosis, and to see the health status of somebody before he crosses the border and interacts with our people here. This is a very big challenge that governments within the sub-region should put measures across the border, and particularly to contribute towards initiatives that can cause peace in the sub-region. I greatly believe the conflict in this sub-region is directly or indirectly contributing to spread of diseases that could have been contained in a particular community. So there is one challenge that I'm seeing after appreciating what the government has done. A few days ago, I listened to, I watched news from an international journalist called Malcolm Webb. He was giving a profile on the state of our isolation center, and it's in a very poor state. They were trying to slash around the things bushy, the tents are in a shambles. This is a big challenge. Uganda being vulnerable to disease outbreaks, I have a very great opinion that these facilities should remain functional to a certain level. We may limit activities therein, but this facility must remain functional, because we are not about to declare Uganda free of any outbreak. So after such an investment to establish an isolation center, and you let it remain in a shambles, has a budget implication and even a negative effect on our health infrastructure. I have an opinion that one of the interventions that should be done should be to strengthen the ability of the village health team. This comrade from Wakiso talked about rapid response team, but as a government representative, I didn't hear him mention the role of the village health teams, which I'm aware is established by health infrastructure in this country. I don't see much of their role being put on the limelight as key fighters in this. I have an opinion that we should have, probably, if for lack of a better word, a modern response team. I don't see any reason why we should not involve technology. Have village health teams trained and given facilities and equipment like GPS for identifying key issues that come up and sending up information to the key people to respond. We should have functional ambulances on a standby, health facilities and health practitioners, experts, to pick information that could come around these communities. Now, this one calls into the question of the budget, because I have an opinion that these isolation centers remain functional. There should be a budget to ensure that this facility is functional. We may have a limited activity there, but we should have isolation centers in this country functional. And if you look at the increase, yes, the government has done a lot in terms of education on SOPs. But when I walk around the city of Kampala, for example, I don't see much of these things. There are pictures or semblance of infrastructure that is put in place to address this matter. Probably, and I think people are being just reactive to a potential lockdown. That you see this market is here, can be closed. You see market administrators putting in place wash hand places, but which are not functional. So can we have these things functional so that the real intervention to fight this disease should not be a joke? Now, if you look at politics, the minister was saying that politics should not be into this issue. I think, my opinion, I have a great opinion that we cannot separate this intervention from politics. What we have to do is to limit politics, because these interventions are going to be can be subjected to Parliament. But the moment it's a matter subjected to Parliament, Parliament is the floor of politics. So you cannot run away from politics, because they will need to approve the budget. They will need to, but politicking, I think, is what should be limited. But we cannot separate this intervention from politics. But the manner in which this politics should play around the health intervention should be of a national interest. Yeah, but that's my opinion about this intervention so far.
Thank you, Mzee Ofono, for your submission on that. Let me get to the medical practitioner. I request that we remove our phones for the better discussion, because they will perhaps divert us. Thank you. Perfect.
Yes, moderator.
We are talking about Ebola virus disease. Someone there, a listener, would love to know, how is this? You have given us the background, but what is this Ebola virus? How someone can get it? Take us through the symptoms, the acquisition or the transmission process.
Thank you so much, moderator. Ebola virus disease is an illness caused by Ebola virus. So there is a lot of medical terms in it, but all that the people have to know is that this is a viral disease that can be contacted from the primary reservoir. In this case, the primary reservoir, most of them are primates and mostly the bats. It is said to have been carried by the bats. So when people engage in consuming meat and are getting in contact with animals from the bush, if this primate or bat or gorilla is a carrier, then this Ebola will be given to this person, or this one dealing with the meat from animals. So this human being will go ahead to transmit it to fellow other human beings, and it is transmitted through direct contact of blood or body fluids from an infected person. So this virus is spread through contact with blood and or body fluids. It is believed to have originated from bats, like I said earlier, or monkeys or apes, and it's a disease that brings about very high fevers with many other non-specific symptoms, and being non-specific symptoms makes it mimic other diseases like malaria, like typhoid, like cholera, and others. So in the early stages, the symptoms that the patient might present with mimic other diseases. However, this fever does not respond to treatment, to other treatment given to let's say antimalarials or treatments for typhoid and those other differential diagnoses. Yeah. So when you have contacted this Ebola virus disease, you are likely to have the symptoms within the second day to the 21st day after contracting the disease. And something to note, which is also important, which is good, is that when this person starts presenting or showing symptoms, it is in that period that is able to transmit it to another person. That's why we need to look out for these symptoms, and when someone presents with them, is held with care and protecting all the others and the rest. So we have early stages, that is within the first days of contracting the disease. The patient or the person that has contracted the disease will present with a high fever. will be having a high fever. Symptoms include also weakness, malaise, headache, muscle and joint pains, red eyes, throat pain, difficulty in swallowing, hiccups, and when we get to the small children, let's say children under 5 years, they will be irritable, crying, and restless. So this patient in the primary, in the primary stage, that's 7 days and below, might have a high fever with 3 of the mentioned symptoms. Then we have an intermediate stage, which is mostly between 7 days and 14 days after contracting the disease. There might occur or appear signs or symptoms of diarrhea, some signs and symptoms of diarrhea. It can be bloody or non-bloody. It can be having blood or no blood. Vomiting, then chest or abdominal or epigastric pain, that's the pain above the umbilicus, and the skin rash. So when this disease advances, when there's an advanced stage or the late stage, that is after 14 days to 21 days of contracting this disease, signs and symptoms will include confusion. Patient will have seizures. Patient might have internal or external bleeding. If this person is pregnant, might have miscarriage. That's miscarriage in pregnant women. And then respiratory distress, that's having issues with his respiratory system. Now, because of losing body fluids through diarrhea, the previous mentioned symptoms, blood, losing a lot of blood internally or externally, let's say vomiting blood coming from the openings, this person, the volume in the body, the volume, the fluid volume in the body will be reduced, and most likely goes into shock because of little volume into the body, and he might go into coma, and he can also die if not taken care of. So I'll have to since the questions are not straight and directed to me
Okay.
I'll have to mention the opportunities that we don't have to miss. Like I've talked, like I've said, the signs and symptoms, one out there might get worried and scared, but I've told you, basing on the stages, we have early stages whereby we start with a fever, and since we are in a period where there is an outbreak, if you have a fever, kindly go to the nearby facility, a clinic or a hospital, so that they can triage and know, so that they can do some testing, so that you know that you're safe. This fever is not for Ebola. Early detection, or getting to know that this patient has contracted a disease, will give you higher chances of surviving, due to the fact that we don't have the exact cure for this Ebola virus. The treatments that we give are supportive and do not cure. We don't have the definite cure, so giving supportive treatment to this patient with early signs gives him high chances of surviving, and then you will get out of this.
Immediately when I get fever, I should go to the health facility around me and I start the Ebola treatment?
Service, yes. No. You have to seek medical services. It is the medical worker that will tell you what problem you have.
Okay.
But early detection cannot be possible if we do not seek early medical care services.
Interesting. Coming to you, Jane, I would love to first engage Damba on. We have heard from Perfect about the signs and symptoms, and I'm asking myself, if someone gets such signs and symptoms and is deep down in Kasangombe, deep in Wakiso, what are some of the first things he or she should do in as far as going about those symptoms? Damba, you talked about collecting samples and testing and the teams that have been put on ground.
Yes.
Guide the person who develops such symptoms.
advising Ugandans, or we advise Ugandans, not me, because this is what WHO recommends, is that for any small ailment you feel within you, be it fever, as the doctor has said, the first thing you need to do earliest is to visit a healthcare facility. And I advise Ugandans that a facility of choice for anybody in Kasangombe is a government healthcare facility. And I have reasons.
Not private?
I have reasons first. That our healthcare facilities have got the expertise. I mean, they go through all what it takes to ensure that they get into those positions of being clinicians at those facilities. That's number one. Number two, at government healthcare facilities, those are the people right now who have got at least the first-hand information about the scourge, about this problem, about the pandemic. At least they have gone and they have undergone quite a number of trainings. So instead of treating yourself, because it is a behavior, it's a habit, not a behavior, but a habit of most Ugandans, is first of all to go and buy Panadol, to prescribe by themselves. As a matter of advice, Ugandans, don't treat yourself. Visit a healthcare facility and you give in your complaint to a clinician. Of course, the setting right now with our healthcare facilities, as it has already been mentioned, is through the triage. They'll know you at first. When you enter, they'll take off your temperature. If your temperature is high, they'll separate you. If this clinician is unable to continue, because we have levels, I've already told you we have level 1, what Mr. Mustafono talked about. Level 1, that is what the village health team, the village health team members, they will take your temperature. You visit them. If you're able to reach health center 2, that is if it is not a weekend like today, still you'll be able to be attended to. A temperature will be taken. And already those people have been trained that after a temperature has risen, is high, they give you, they have a checklist. They'll ask you a few questions that will lead them into the next level of action. If it tells that maybe you will be a suspect, the next thing they will do, they will hold you. Holding, I don't want to use the word isolation, because at those levels, they hold you. You know, you need to use some of these simple words so that you don't stigmatize people. They'll hold you as they inform the people they talk of the higher authorities. They're supposed to hold you in a particular area designated away from the rest of the patients. Then from there, they'll call the people who are concerned to handle you on the next level. That is, 1, the people who are supposed to take maybe a sample if it is required for that level.
Okay. Interesting.
Wait a bit.
In seconds?
Yes, just in seconds. So that is if just in case you may be suspected to be having Ebola. Otherwise, if it is a temperature and with these other questions, you are not fulfilling the definition, they'll treat you in the normal way or like other patients. That's where the difference is.
Okay. Thank you so much, Adamba. Jen,
Yes, please.
as you heard from the people of Uganda, I started with the statement of the minister cautioning the people of Uganda not making jokes or politicizing the Ebola virus disease. And Mzee Ofono said that we cannot separate politics from this, but perhaps politicizing it may not be good.
Yes.
Where does politicizing Ebola virus disease leave the efforts and the energy that has been put in the fight against this disease?
Of course, it waters down every effort, and that's why
And where did it come from?
the politicians. That's why it should be enforced that anyone found politicizing this, because it's a matter of life and death, that means that person is an enemy to Ugandans, perhaps wants to see us dead. So there should be some punishment of the sort, because I remember the same group of people made a bit of jokes with corona while Ugandans were dying. And so many of them tell communities that there is no Ebola, there is no this and that, while our people continue to die. So whoever politicizes this, I think must be punished. That person is an enemy to Ugandans. I strongly support the statement of the minister, because you can imagine in a situation where we have a serious outbreak as a country and everyone is trying their best to stay healthy, and then there is this well-informed politician in a given community telling Ugandans that there is no Ebola, there is no corona, these people just want money. But how? So there should be a very strong punishment given to such people. And talking about the different efforts that are put in place, I think this is a problem for us all as a country. We need to cooperate, we need to join hands and kick Ebola out of Uganda. It's quite possible once we do this together as Ugandans.
Interesting. Thank you. Perhaps I loved taking us through the status. That was, I think, last week, where 15 cases were confirmed. 13 cases, confirmed cases, were linked to case 0881 from Kasanda. 9 were family members to the case 81 from that Kasanda still. 2 were health workers who attended to the same, and 1 was the neighbor to the home where that case stayed in Masanafu from 10th to 12th October this year, and one met that case 81 in Mlago, holding unit while taking care of the suspected case, who was the husband in this case. And we had 1 risk contact, who was the uncle, and 1 was a risk contact from Kirudu. And perhaps taking us through the journey of Ebola virus disease when it reached Kampala, a case that was in Kasanda on 18th September, where the case 081 was 33 male, first visited Gomelo Medical Center, went to Mitiana on 10th October, traveled from Kasanda and visited Grace Clinic, went to Masanafu on 10th October, stayed at a brother's home in Masanafu, and Malago 11th October, visited NSRL clinic, went to Marago on 12th October, admitted in Marago, and on 13th October he died. And so many people who have been in the contact of the same case have been victims. Ebola has gone to schools. It is in the hospitals. People are scared. The government has started put some measurements, including restriction of movements. As we see, for some 5 districts, including Kasanda and Mtiana and the neighboring communities, are not allowed to move. There is a lockdown of 21 days as a presidential directive. Where does this leave us? But we also have some chances of people getting healed. They are recovering from the same. One may think, why is it that some people are dying and others are surviving, yet they are subjected to the same medicine? Doctor, can you take us through the treatment of Ebola virus disease?
Thank you so much, moderator. I may not tell you the drugs, the names of the drugs, because that might not benefit, but I'll tell you some of the reasons, some of the factors that
where some people
contribute
die
to-
and others survive.
to that. Yeah.
Mm.
Mostly you'll find these tracked cases, the positive cases, are gotten from communities, yes, but they are gotten at different times. For example, one contracted the virus 20 days ago, or the first day he got signs, started hiding from the authority, or probably went to the clinic. I appreciate my colleague here who emphasized that visiting government facilities is a better option. I second that idea because currently it is the government that is dealing with that, and once a private facility gets a positive case, he has to call the government to take to the Ebola treatment centers. So, like I had said earlier, early seeking of medical services is very key and paramount. I may not know specifically those who died, with the cause of between those who survived and those who died, but it is definite that those who came late with signs already vomiting blood because of delaying to show themselves, or playing sick and hide from the tracking team, which is highly discouraged, must have ended with poor outcomes than those that got the early signs and presented themselves or communicated and went to the treatment centers. So that is one strong factor that we cannot do away with, that will contribute to your survival rate. Well, the other one that is obvious in the medical field is the comorbidities. If you already have your chronic illnesses, and then you get another disturbing disease, virus like this one, the survival rate might not be the same as the other one who is fit and has no chronic illnesses. So that one is another strong factor also that could indicate reason why some can be on the same treatment, but some die and others survive. And then the other thing medically is that patients respond to treatments individually. Here I may not have the specific answers, but the body responds to treatment differently. If you give treatment to this person and then the second person and the third, they are likely to respond differently. So it is on an individual basis. However, being early detection, being detected early and receiving treatment faster predicts better outcomes. And yeah, that answers the question.
Interesting. Mzee Ofono, this is not the first time we've been hit by Ebola virus disease, I believe. And we have so many times, every time it hits us, we are so much affected. But it seems we have learnt less or no lessons, considering the energy and the efforts that have been put by different institutions, but affronting government in this case. Do you see that we have learnt a lot, and we're investing what is necessary to fight Ebola virus in this regard, or this time?
You see, my observation today is that the level of information or information exchange today is quite high as opposed to the 2000 Ebola outbreak. And even when the 2000 Ebola outbreak did not have opportunities of the easy means of communication of sort of today, I tend to respond to your question with a question. We are lucky we have a doctor here. The Ebola which killed Dr. Lukwia, one, there was a very quick response by government, yes. There was no restriction or lockdown, yes. The disease was effectively fought. I am wondering the difference between probably the other strain and this one, that this one requires for stringent lockdown as opposed to the other one. I'll need to be guided because I am a little layman. But let me take you back to one of the presidential addresses to the nation during the COVID-19, when parents were crying out to him about the pregnancies of their daughters while they were at home as opposed to being at school. I stand to be educated, reminded. He said that he told the parents that pregnancy does not kill. Does not kill. So even when these children get pregnant, they will not die. They will manage life after that. This one brings me to today. The lockdown or no in the approach to this question. Recently, I learned of a report from Uganda Revenue Authority of several billions in performance as better than the projection. To me, this was an indication that the economic recovery program that the government put in place after the COVID-19 is gaining ground. Probably one, those interventions, those assistances and support that were given to the economy, players in the economy, and two, the magnitude of the people's response in the economic activity probably could have been improved. But now there is a question of the economic life and the life of the people. This one versus the other. For the economy to thrive, people must be alive. For people to be okay, the economy must be alive. I am of a great opinion that the people who are trying to push for a lockdown, particularly in the heartland of the economy of Uganda, or Kampala and Wakiso, shouldn't advise the president that way. We should have more aggressive response approaches.
Even when people keep dying.
You see, death will be there, but even when we die, others will live on. But for them to live on, there must be a mechanism of survival. We will not run away from that. My request to this nation, if it means tripling or quadrupling the supplementary budget for the cause of the aggressive intervention and surveillance and all measures of approach to have this thing contained, should be the best approach. Let no member of parliament object to supplementary budgets and all these kind of things, other than locking Wakiso and Kampala. That's my strong opinion, and I'm not about to change from that opinion.
Interesting. This is UBC Ground Zero. We're broadcasting live on 98 FM, UBC Red. We're also live and clear on our sister radio stations, UBC Butebo, covering the eastern parts of this country. We're also live and clear on Western Nile FM, covering Teso sub-region, Karamoja sub-region, Lango sub-region, and northern parts of this country. We're also live and clear on Magic 100 FM. We are also streaming live on YouTube. You put UBC Ground Zero and you'll be part of this conversation. Remember, subscribe to our YouTube channel. And I'm going for a very short break. When I return, I'm going to get some of your calls and you tell us what needs to be done to fight Ebola virus disease in Uganda. This is UBC Radio.
This is Ground Zero live on UBC Radio. Stay tuned.
The Link on UBC Radio, connecting you to the world of information.
Ebola virus disease is a serious, often fatal condition in humans and non-human primates. Ebola is one of the several viral hemorrhagic fevers caused by infection with virus of the Filoviridae family, a genus of the Ebola virus. Ebola is considered a zoonosis, which means that the virus is present in animals and is transmitted to humans. In Africa, for example, people have developed Ebola after handling infected animals found ill or dead, including chimpanzees, gorillas, fruit bats, monkeys, forest antelopes, and porcupines. Person-to-person transmission occurs after someone infected with Ebola virus becomes symptomatic. It can take from 2 to 21 days for symptoms to develop. Transmission of Ebola between humans can occur through direct contact through broken skin and mucous membranes with the blood, secretions, organs, or other body fluids of infected people. Indirect contact with environments contaminated with such fluids can also lead to the spread of Ebola. Then we also have exposure to contaminated objects such as needles and razor blades. Burial ceremonies in which mourners have direct contact with the body of the deceased who has succumbed to the Ebola virus can also lead to the rapid spread of the disease. Exposure to the semen of people with Ebola or who have recovered from the disease can still spread the deadly virus, as that virus can still be transmitted through semen for up to 7 weeks after recovery from illness. Contact with patients with suspected or confirmed healthcare providers or workers have frequently been infected while treating patients, and actually some of them have lost their lives. However, worthy to note is that there is no evidence that Ebola can be spread via insect bites such as mosquito bites or fly bites. The fatality rates of Ebola vary depending on the strain. For example, Ebola Zaire can have a fatality rate of up to 90%, while Ebola Reston has never caused a fatality in humans. Severely ill patients require intensive supportive care. Ebola virus disease is often characterized by the abrupt onset of fever, intense weakness, muscle pain, headache, and sore throat. Ebola tends to spread quickly through families and friends as they are exposed to infectious secretions when caring for an ill individual. The time interval from infection with Ebola to the onset of symptoms ranges from 2 to 21 days. Ebola is considered zoonotic, and there is currently no vaccine available for Ebola, although several vaccines are being tried in laboratories. Preventing transmission is achieved by ensuring all health workers wear protective clothing, implementing infection control measures such as complete equipment sterilization and routine use of disinfectant, isolation of Ebola patients from contact with unprotected persons. Thorough sterilization and proper disposal of needles in hospitals are essential in preventing further infection and halting the spread of an outbreak. Ebola tends to spread quickly through families and among friends as they are exposed to infectious secretions when caring for an ill individual. The virus can also spread quickly within healthcare settings for the same reason, highlighting the importance of wearing appropriate protective equipment such as masks, gowns, and gloves. Now that you know what causes Ebola and how it can be spread, take care of yourself and protect yourself from the deadly virus. I'm Katharina Twine for The Link. Stay tuned.
The Link on UBC Radio, connecting you to the world of information.
It's hot.
We passed it. We didn't know exactly what the problem was on the ground. There is no pretending about the effect of this thing. There's no pretending about it. Nobody showed. It's a problem.
It's balanced.
This is not the stage at which you start planning to tax a commodity like coffee, especially from down there.
It's intellectually engaging.
The Constitution provides that the land must be registered under the customer tenure system, which is one of those that's recognized by the Constitution.
Ground Zero Season 2, live and syndicated on your public and national broadcaster, UBC, inspiring Uganda. Welcome back. Ground Zero Season 2 continues.
Hello, dear listener. Welcome back from that very short break. This is UBC Ground Zero, and we're broadcasting live on 98 FM, UBC Radio. We also live and clear on other radio stations, UBC Butebo, UBC Western Nile, and Magic 100 FM. And I believe that we are having a very good moment in this very discussion. Empowering communities to fight against pandemics. Damba Emmanuel, Senior Environmental Health Officer, and is the Infection Prevention and Control Focal Person from Wakiso District Health Office. And I also have Harenimana Perfect, is the International Patient Coordinator from Nakasero Hospital. I have Mamzei Ofono Charles, is the Executive Chairperson, Foundation for Rural Housing. And we also have Jane Francis Oling, is the Executive Director of Women Involvement. Ampaide Amon Otegri is my name, and this is the right time you call us on 776-511-426 to share your opinions. UBC?
Amon.
Yes, please.
Jima from Busega.
Most welcome to UBC Ground Zero.
Thank you.
How are you fighting Ebola virus disease?
I'm trying to keep myself with the proper hygiene and the sanitation within my environment I'm living. Doctors, they have to help us also about fighting stigmatization. I had some time back, a patient ran away from hospital and he pushed into the Tanzanian side. And up to today, I have not got the information that maybe.
Okay.
Then how they are welcomed at the health facility. Some of people, they are fearing to go to the hospital because how they are being harassed. We need professionalism.
Your network, Juma? Juma, you can call us again on 776-511-426 and raise your concerns on what needs to be done to ensure that we engage ourselves in a better fight against Ebola virus disease. UBC?
Hello, this is Martin from Muyenga.
Most welcome to UBC Ground Zero, sir.
I'm greeting all people which are there in UBC.
Okay.
And thank you for the show.
Most welcome, sir.
Yeah, my question is simple question. In Orova, even I want to just those doctors to answer for me. In which year the first Ebola came to Uganda? And then even that Ebola, I survived and I survived. It was when I was in Kituri. And even the people which they came there, they came to UN to rescue us. But people which they remain there. And people, when that time they brought us in Kapkero, that is Kasese, they hide us there. They put us there with the UN. So other people also, they took it to Kilembe Hospital. Others, and then others. That is thing. I think it's true even according to the toilet. You imagine if they are saying that they show the signs, what. We're about like one battalion. We're one battalion all were in there in operation. But actually, the way people they die, and even I can't manage to talk, even I'm shaking my heart even, and even let me just stop. People are saying that they are looking for money, or Museveni wants money, or what. Let us put it in the hands of God. Because if I talk about Ebola, it is not saying that handling what. Okay, bye.
That's Martin from Yenga, and he tells the story and his experience of the same virus. He says he was affected by the same, and most of his colleagues were affected in Kasese. So for you who are still politicizing this virus to be a game, to be a joke, to be a means of earning money, I pray that indeed God talks to you. 776-511-426 is the number you can call and share your opinion. Ampaide Amon Ortega is my name, and this is UBC Radio. UBC? Ground zero. Oh, I've lost you, the caller. 776-511-426 is the number you can call. I have two questions from two concerned Ugandans. Juma says the people fear to go to the hospitals, but when you go there, there's more drama. The panic, the fear increases. You are handled as if you're, I don't know. Doctor, is that how you handle really patients, or someone is already scared?
Thank you, and for that caller, thank you for the concern that is expressed. How I wish everyone was listening to the radio and pick up what is his for everyone to clean up or put in line what is not being practiced well. However, on my side, that is not how I receive patients, and so is the team. But we have very many facilities around, and if he experienced that, then and I wasn't there, then probably it was so, or it was his perception. However, I take this chance to encourage all the health workers not to be in fear and to use the protective wears, the appropriate protective gears, so that they do not contract the disease. And also, while interacting with the patients or suspects, to be calm in a composed mode, and also to use the available protocols while handling these patients, to avoid the stigma or to avoid causing these delays that makes people refuse to come to the health facility, putting in mind that they will be mistreated. If that case has happened, that was unfortunate. But I encourage all the health workers and also the patients or the people that go to seek the services to follow the orders and the directions. It is a two-way thing, because that is a perspective from the patient, not from the health worker. I haven't heard from the other side. But I encourage that everyone does what is meant to do in a calm way and harmonizing manner for us to fight and contain the outbreak.
All right. UBC. UBC.
Hello.
You're live and clear on UBC.
Yeah, I'm talking to Bonnie.
Bonnie. Okay, you're concerned about Ebola virus disease?
So now, hello?
You're live and clear.
Yeah, I've had some issues. I wanted to get advice from UBC.
Okay.
Yeah, now I've been having a certain lady from Western who has been murdered a kid with one. So now she decided to leave the baby when the baby is 1 and 8 months. So far now the baby is 5 years and still 1. So this lady wanted to come and pick the boy. That is, wanted the boy to go and see the side of the parents.
Okay. Bonnie is listening, and I believe that your matter is going to be handled soon or later. UBC?
I'm sorry, my airtime was very little.
Okay, your concern again?
Yeah, so I was trying to say, stigmatization is one cause whereby people are not willing to go and check up, or to go and do tests, or to go and engage with the health officials. To me, I call upon the Ministry of Health more sensitization to the community. And I also feel sorry to some individuals on their own perspective, turning Ebola's issues or corona issues or HIV issues into politics. It is not a political. And when you go down to the village, I feel like if those people in the top offices, they should also stop using other people to spy on others. You have a free fuel, you have a very good vehicle in a good condition, one time. Don't even everyone knows your opinion. You drive, go where you're suspecting there might be some problem. Go by yourself and observe what is taking place within the community. You will come back, you will feel ashamed, and you will feel like to come and sack all the local leaders who are within the places. So to me, Ebola is not new. The first Ebola when I compare the first Ebola with the first HIV/AIDS, someone got AIDS today, 3 months, someone is dead, and remain in a bony scale, you know. But today, with the modernization, scientists have done a lot. Even when you are tested, you are positive, whatever disease it may, you can still live longer. So it needs counselors who are also professional and experienced to engage with our community. You know, these diseases, when you come, you bring government closer to the community and they combine themselves, that's the way to go. Things will become easier.
All right.
But when some people, they are diverting themselves, no, this is business, government, what? No. Security officers who are embracing this should not take so as an advantage for them to earn their living. You are earning your living every month. You are earning your salary. Don't bribe. Don't cause corruption. Do what you meant for the love of your country. As the motto of Uganda said, for God and my country.
Okay.
How are you defending your country when you want to milk money in an idiot way? I'm sorry to say this.
All right.
I thank you very much.
Most welcome, and thank you for being part of the UBC Ground Zero. UBC 776511426. Damba, how can we deal with stigma? Someone is a victim or a certain family, they have tested positive for Ebola virus disease, and especially people in villages, even here in urban centers, they tend to distance themselves from such cases. How best can we deal with that? Let me get this caller first. Allow me. UBC?
Yes, Amon, this Martin has come back again.
Your concern, please, in seconds.
Yeah, so I had one doctor is saying that, don't go and buy Panadol, don't do what. Even if you go in the hospital or a sub-clinic or whatever, the first thing they give you to write to you, go and buy what? Your tablets, they're outside. Oh, go and get this, go and get this. But actually, those people from the in the hospitals there, no work, they will say that there's no Panadol, there's no medicine, there's no what. So where are we going to get those things if they are not the ones that are giving us? They are sending us to the clinic. We don't have money. We don't have what? So unless let them patrol those health centers, yeah, let them go there like just a visit to have come for treatment and see. They will see. They will tell him that go and buy this. They send him directly if the clinic is opposed to them.
All
they
right.
will tell that go to that clinic there and there buy that medicine. That's
Okay,
my
sir.
option.
Thank you so much for that concern. I'm glad that I have a health worker here who works with government. As you're answering the stigma question, people are saying there is no medicine in those hospitals of government. When they come to you, you are saying that people should run to your hospitals, government hospitals, but the same facilities, they don't have medicine. You still bounce the same patients to go back to the private drug shops and clinics. Damba?
Let me just first of all try to guide the caller. The reality is government has it all when it comes to services, health services. That's why I still say that continue to visit the government health facilities, particularly in this Ebola. And going back to the Panadol bit of it, I only give it as a not even an example, but that I told you people that instead of you having the headache and then you are feeling the headache, the fever, then you go for Panadol. It's not good. First get to the government health facility. They examine you. After examination, sometimes they even do their diagnosis there and then. That means maybe lab is instructed for you, and then they treat you. They prescribe for you, and you are given the medicine, as long as it is essential medicine that we always have.
Right.
We have what we call essential medicine. So that is the clarity which I can give you.
Stigma.
Then going back to
stigma.
stigma. It is a situation that is everywhere. We saw it during COVID, people beating up other people because they know, because they heard that this person came from Dubai, he was given strokes. Why aren't you going for treatment?
Self-quarantine.
Self-quarantine. All those that has been, it is a situation. Coming to case 81 in Masanafu, we reached there, and the community around, actually when we tried to ask the people who are now surviving and remained at home, that was the neighbor to the case, and that was the husband and the wife, and maybe even one son who was remaining. We asked them that what is happening. They told us, people are now pointing at our gate, that is a danger zone. Don't go there. Don't interact with those people. So
they are sick.
So all that is what is stigma. It is an area which has not been exploited well by government. In fact, the person responsible for fighting stigma, they are called the psychosocial support staff, or we call them sometimes counselors. It is my recommendation that government creates those positions in the government structures so that they are employed directly. We've seen this, it is still happening. However, what are we doing to mitigate the current situation? Number one, we are dealing with it through communication with the cases. Sometimes if we are to go maybe there to evacuate them, we go casually. We call them, sometimes not in those times when everybody is seeing. So we are trying to do administrative controls to ensure that the community around does not get excited. Otherwise, it is a recommendation to government that counselors should be directly employed. Otherwise, currently we only have them in private settings.
Damba, people think that you, the health workers, are the ones that are fueling this kind of stigma into the populace. When you come and there is a case in Masanafu or in one of the places around, in Kasangombe, if I may ask, because that's the place I know best, or in Gombe, Wakiso, Kayunga, the way you come in, vehicles, and you surround the place, you engulf the place, you close the doors, you don't allow anyone to move, and when you leave, the same people take the same effort. Are you not responsible or bothered for creating this kind of panic into the population because of how you handle such cases, or your response team?
Mr. Moderator, I've already told you how we are mitigating. In fact, even the vehicles nowadays which we use, they are private vehicles that come into the cases compound, and people even casually, they move out and they do what we call putting on, or the donning. It is done inside.
All right.
Inside. So we never want to cause the problem. And also the other bit, the way we do it is to ensure that we engage the communities around.
Interesting.
The neighbors,
Jen?
talk to them, and then they don't take it as a tall order that this person is now an outcast.
Jane?
Yes, please.
Is it my right to get treatment, to get good treatment from the government, or government is doing us a favor to treat us and provide all these facilities?
It is absolutely your right to get treatment, but also government is playing its role very well, because much as it is our right, there are situations where government could have relaxed, and in this case, we really appreciate they are playing their role very, very well. And that's why there are government health facilities put in place. And it is important that our people make use of such facilities, because we also have question marks on private health facilities. Not all of them are doing the right thing, and not all of them are employing the right people. So our people are much safer in the hands of government.
Should we demand government to provide such health facilities or services to us, or we should wait for them to do as they wish?
No, we should demand, and this comes with accountability. This is why we have the ministry, the whole Ministry of Health. Ugandans should demand for proper health services from government.
Proper medication, proper treatment, availability of health workers.
Exactly, and accountability to that effect. Yes.
Interesting. Allow me, before I come to you, Perfect, on how best we can prevent, and I want to know what speeds up the spread or the transmission. Let me go to Ofono, as you're thinking about that, Perfect. Housing conditions contribute a lot in the pandemic, or the spread of the pandemic. Considering Kampala, where it is most congested, homesteads right away from home, you find that in one home there are about 10 members. That itself is a congestion. When you go on the streets, when you go in our transport, it means that this also is a means to spread. Also, where the people you come from, the village settings or the rural settings, we used to know that these pandemics are spread, or they are so much into the urban centers, but they have now started from Kasan, Mubende, as the rural leaders. What are you doing?
I am afraid you've answered the question you asked me to answer. I will simply refer to two places in comparison. Two patients suffering from the same disease, one living in Kololo and another one living in Namungo. The one living in Kololo has high chances of recovery very fast.
We should go to Kololo, all of us.
I'm giving you examples. Because of the nature of the planned settlement, the state of housing, as opposed to Namungo, where we jump trenches of wastewater to go to our houses. You are right. The housing condition is very, very, very important. And this is why we have been on the front line to do the little we can to support the formation of housing cooperatives as a method of the people to access decent accommodation for themselves. You attempt to rekindle my opinion about why the national housing policy of 2016 is gathering dust. In our investigation of the policy was passed with a certificate of no financial implication. That one tells you how and why the government is not spending in the growth of the sector. Now, if I narrow down my response to your question, probably with relationship to the questions that have come from the listeners, the Panado question. Not very long ago, I was, about 2 years ago, I went to one of the pharmacies, private pharmacy. I was feeling feverish. I said, let me pick something. And I was surprised to get a private practitioner who was very, very ethical. She asked me, can I have your medical form? I must confess, I did not have any medicine. She said, without a medical prescription from a doctor, I can take you to that clinic. I was surprised. That is how ethical these practitioners should be. So the man of the Panado, You rather go to a medical facility where you are going to get diagnosis at a free cost. Walk into a pharmacy and buy a prescribed medicine. That's how best you can, if the facility is there, rather than going out to prescribe your own.
Interesting.
Yes. Now, let me look at this perspective. There's been ethical issues that have been raised. The patient-doctor relationship. This one will call for performance appraisal. I strongly believe that this could be one of the issues. Now, you see, the PPEs, as doctors refer, most of these doctors are subjected to these scenarios. And when there is an epidemic of this nature, somebody does not have gloves, does not have one, patients or suspects are trickling in. Naturally, there is that fear that may cause a doctor to act that way.
Okay.
But I'm also aware of doctors who are not doctors. Teachers who are not teachers.
They are what?
Engineers who are not engineers. There are ethical issues that you must embed into your practice.
Interesting. Perfect. What spreads up this virus?
Thank you so much, moderator.
And who are the most vulnerable?
I'll start by giving a guide on what should be done or what is required in controlling an outbreak. For now, we have the Ebola virus outbreak. Recently, we have had COVID-19
outbreak,
and there is a multiple of requirements that are needed, and this is multifactorial, basing on the medical teams, and then the communities. So, majorly, there should be coordinated medical services. There should be community engagement. And this includes rapid detection, contact tracing of those who are exposed, quick access to laboratory services, care of those infected, and proper disposal for the dead, maybe through cremation or burial. And I am glad that our government has tackled most of these as a government. The gap, according to my observation, is remaining in the community, and the biggest contribution is ignorance. People do not know much about Ebola. A few are aware of how it's transmitted, and so government has put in some initiatives to sensitize and tell them about this Ebola, and more energy is required. So the vulnerable people, everyone is vulnerable. That's the first point. And then the second point is that those that are in places where these cases are accumulated, those in the epicenter, the Kasanda, Vende, where this started from, they are most vulnerable. And then the medical team, because when you feel bad, when you're having a fever or some derangement in the body, where do you go? It's to the health worker. Those are also most vulnerable. And I must let the people of Uganda know that there are other small challenges which breaks into big ones. For example, like caring for a loved one. If your child or if your husband, if your loved one has gotten Ebola, you will be mostly attracted to get close and take care of this patient. And yes, you're supposed to keep a distance. So there.
All right. Yeah. Our time is fast spent. We have a few minutes to end this discussion. But before we do that, Damba, do we have enough vaccines for Ebola virus disease?
Thank you very much. Currently,
we're talking about treatment, but do we have enough?
Currently, in the country, we don't have any Ebola vaccine. What we have is COVID.
What are you treating people with?
What we have, the way of approach for management of Ebola is what we call supportive treatment. Supportive in a way that this is a virus, which you don't have a drug for directly to make it die. So what is given are supportive management. For example, if it is diarrhea, people get dehydrated. We give the rehydration with some drugs. If there is any any disease that shows other than that comes up, we treat that disease other than so it is a way of plus even psychosocial support as well, good feeding, just to mention but a few.
How about this one that I've heard that it is undergoing through clinical trials? Have we made our own, or we're testing something that we have imported?
I don't have information about that as of yet. I need to consult. But it is my pledge that government should put in a lot of effort and resources in research to ensure that we tackle this problem of the pandemic Ebola.
All right, interesting. I want to, we have few minutes as I said, but I want to get your opinions, all of them on the same issue that I'm going to be raising one after the other, starting with the herbalists, use of herbs. The first case, people think that it intensified because instead of seeking medical attention, the person went to the witch doctor in this case, and that could have worsened the situation instead of seeking medical attention as early as possible. And people still believe, especially in those who live in rural settings, that herbal medicine still works. Let me start with you, Damba, your position on herbs.
Thank you very much. And this is to all Ugandans and the traditional Ugandans, I may say, that when it comes to disease, the first approach for anyone who gets sick should seek medical advice from where we can have the what we call the evidence.
Okay.
The evidence is only got from government healthcare facilities or government facilities per se before you go to any other place. In fact, with government, it has also taken a stride through those leaders of the traditional healers, herbalists, to ensure that those people are sensitized, not to admit cases of Ebola, cases where they have been sensitized on Ebola, so that such cases, if they interface with them, they should refer them to government healthcare facilities.
The same government appreciates the works of the herbalists. As if I'm not mistaken, I need to be guided. If COVID-19 is not part of the herbal medicines that we have in this country.
Come again?
It's Covidex that was used in COVID-19 time. Part of the herbs that we appreciate as this country.
As long as it has gone through the protocols.
Okay.
Yeah, the protocols that require NDA to approve.
Jane, your position on herbs, local remedies.
You see, I happen to have Professor Gwang as my most immediate neighbor here in Kampala. And I trust the Covidex saved me and my family as well. I trust the process, and just like my colleague has just said, that as long as it has gone through the protocols and NDA, other tests and things like that, then approved. I think the herbalists have played a role in supporting us go about these pandemics. So we should count on them as a collective responsibility, as long as they stand the test.
Perfect.
Thank you so much. I think this is a very big point and we need to exhaust it. Though it has come at the last time, I'm so much against the herbalist this time around. Well, they might have contributed in the time of COVID, but I beseech the team to kind of don't bring in COVID this time around, because Ebola is very different and we don't want contacts. Once they go to these herbalists, they will be instead increasing cases. This is very highly discouraged. Please go to the government facilities and other health facilities.
Mzee Fono, When I was growing up as a kid, an African kid, there are herbs, local remedies that were given or administered orally and other means, and they would cure. We have, I don't know how I don't know the botanical or English names, but we have herbs that would stop blood clotting, they would put on wounds and they will heal immediately. We had herbs that would cure, and even now they are still there, that cure malaria and many other cases, serious cases by the way. Can we not tap into our local medicine and perhaps deal with this kind of pandemics or outbreaks? Because we believe that every medicine comes from herbs.
You see, let me make this statement without fear or favor. You have it recorded. Herbal medicine is here to stay, whether we like it or not.
Even if it has not gone under clinical tests and
what I'm
approved by DNA.
What I'm calling for is from the central government to intervene and provide regulations, support, to give knowledge and ability of the practitioners to offer services. We will leave herbal medicine here, I must confess.
Interesting. At least I have someone who believes in that, and it has been recorded. Let me get your opinions and ideas on another aspect, lockdown. Many of the professionals are coming from the health sector. They think that if we restrict movement of people, close markets and arcades and shops, perhaps we are likely to have this handled very well. Let me start with you, Damba. Do you think the lockdown is then a better option?
My submission on that is that all what we need right now and what is hitting us, even when we are doing the response to Ebola, is the resources. And I'm so much aware that as government, we went through COVID. We had what we call it a depression in the economy. We only now begin to come up again.
Okay.
And if we continue to say that we go to a lockdown, I don't think that is the best answer on my side. What can be done is the little resources, if redirected into the mega approaches that have been proposed.
Okay.
We can go a long way.
My time is taking me not to board. Jen.
I'm thinking the issue of lockdown depends on the situation at hand.
Can we have our phones put in silence, please? I request.
Okay, that has been sorted. Sorry. I'm thinking the issue of lockdown depends on the issue at hand.
Okay.
There are situations where, as a country, we can't avoid to have lockdown if it saves the population.
Perfect.
I think it's the best thing to do.
All right. Perfect.
Thank you so much. I am calling upon everyone, people of Uganda, to implement what the government is telling us. Given the cases, do not do seek and hide. If we reduce the cases, we can contain it. But if we fear lockdown and yet we do not follow the directives and the protocols, then there's no way you can avoid that.
Yeah. Ofono?
I already made my position known to this. Don't lock down Kampala or Kiso. Those locked down areas probably is an eye-opener. Let us use the infrastructure we have in place, channel enough resources, and support the system to fight. Ebola is contagious, yes, as opposed to COVID-19. We went through the 2001 outbreak successfully without a lockdown. We can still do the same. I beg to submit.
Interesting. This brings us to the end of our discussion, and I must thank you for being part of us from the time we started. This is not the first time we're having Ebola, and this is not the first outbreak that we have. We have COVID-19, we have the Ebola, but what can we do to prevent the other outbreaks in the future of the pandemics of the Ebola type and COVID-19? And what are the long-term solutions for such epidemics? Let me get your opinions as you give your way forward in only 1 minute. I'm starting with the lady, as they say, ladies first.
I'm thinking, as the doctor has just said, Ugandans, we can, put our efforts together and fight this, aware of the fact that it's not the first outbreak, and also aware of the fact that we can collectively fight this. We can cooperate and know the right things to do and seriously do them, and soon this country will be free of pandemics.
Perfect.
Thank you so much. Mine will be encouraging the Ministry of Health to keep trying different treatments and drugs for different outbreaks we keep getting, like the minister recently said, including that we are getting some treatments, including monoclonal antibodies and repurposed drugs like remdesivir, donated by the US and other countries. So with that cooperation, we need to come out of the outbreak and have a permanent solution. Once it comes back, it hits and goes back.
Mzee Fono?
The current outbreak of Ebola has not come out to look for members of NRM. Neither has it come to look for members of Uganda Post Congress. I'm well aware that it is not looking for members of National Unity Platform. It is not looking for members of Democratic Party. I call upon sector players at that level to lock horns together, have a common fight. We see the back of Ebola. I beg to submit.
Thank you, Mzee Fono. Damba, Emmanuel?
Finally, on my side, we have to make things change for the future. Things to do with the redesigning our infrastructures, right? Things like even the hospitals or healthcare facilities, to ensure that in case of interface with the new outbreaks, we are able even to safeguard the healthcare workers. When it comes to the communities, infrastructures should be given redesigns to cater for example, hand washing, for example. Let it be a permanent fixture that should be put even at the entrance, than having these mobile emergency, having emergency hand washing facilities at parks, at markets. We need those permanent infrastructures redesigned and put even in policies and addressed.
Okay. Interesting. Thank you, lady and gentlemen, for sparing time to educate and inform the people of Uganda about Ebola virus disease. And I want to thank you, the listener, for being part of this discussion from the time we started. Those of you who are on radio and those who are online, according to the World Health Organization, as of 26 October 2022, there have been 115 confirmed cases of Ebola virus disease, including 32 deaths. Case fatality rate goes to 28. Among these, at least 11 healthcare workers were infected, and of whom 4 have died. There are also 20 deaths among the individuals who died before a sample could be taken, but were linked to the confirmed cases. 34 cases have recovered. That is interesting, and we must recommend the institutions and players that have contributed this. And since the last report on 21st October 2022, there have been 51 new confirmed cases and 7 new confirmed cases reported. New districts reporting cases this week include Kampala with 17 cases, Wakiso 2 cases, and there are current 7 Ugandan districts affected by this outbreak: Bunyangabo, Kagadi, Kampala, Kasanda, Jejegwa, Mubende, and Wakiso. The majority of the new cases are epidemically linked to the known cases. Of the cases reported in Kampala, 13 are linked to the man from Kasanda district who previously died in Kampala, and these cases concern his family members, including the wife and 6 children who attend different schools in Kampala. I pray that you and I safeguard ourselves from being victims of Ebola virus disease, because it is so much serious that you not think. The health officials have confirmed 2,430 contacts of the cases, of which 1,022 have completed the 21 days follow-up, and we must still recommend the health sector, especially the ministry, for the 34 recoveries. And I pray that even the others keep recovering. UBC, we keep educating, transforming, and inspiring you about health and other sectors. I must thank you, all the people that have spared time to talk to us. Adamba Emmanuel, Senior Environmental Health Officer and is Infection and Prevention and Control focal person from Wakiso District. Haredimana Perfect, International Patient Coordinator from Nakasero Hospital. Ofono Charles is the Executive Chairperson, Foundation for Rural Housing. And Jen Francis Oling is Executive Director, Women Involvement. Ampaire Amon Obtega is my name, and from all of us at UBC and from the entire team that I worked with today, we wish you all the best, and for God and my country, Ampaire Amon Obtega, allow me to sign out.
That was Ground Zero Season 2, a production of Uganda Broadcasting Corporation, UBC, inspiring Uganda.
Tune in to Ground Zero on UBC Radio. We discuss politics.
The money we collect as taxes in the country, we lose it in corruption.
Economics.
The 4 economic sectors where there are jobs and wealth are commercial agriculture, industries, services, and ICT.
Education.
The classes which will not need an abridged curriculum are the entry-level classes of P1, Senior 1, and Senior 5.
Culture and religion. And other areas of human interest. Ground Zero every Saturday from 10 a.m. to 12 p.m. on UBC Radio. Don't miss.
The Link on UBC Radio, connecting you to the world of information.
Ebola virus disease is a serious, often fatal condition in humans and non-human primates. Ebola is one of the several viral hemorrhagic fevers caused by infection with virus of the Filoviridae family, a genus of the Ebola virus. Ebola is considered a zoonosis, which means that the virus is present in animals and is transmitted to humans. In Africa, for example, people have developed Ebola after